Yes, because we are just about to start our health talk. Earlier on, we were waiting for the rest to join us. So a very good afternoon to everyone. Welcome to today's our community health talk. And the topic today is slightly more sensitive and something that our nurses would like to touch on and to share with all of you as well, which is live well with an end in mind, palliative care. It's I would say it's a quite a sensitive topic whereby some of us might not be willing to share about, or something that felt that it's a taboo topic to share. But today we will have ANC Jolene and SSNCP to share more about this topic with you and how we can understand this topic better as well. So passing over the time to you.
Hi, can you hear me? Thank you, Felicia. Can you hear me?
Yes, we can, Siti.
Okay, thank you, Felicia. Okay, so afternoon, everybody. I hope you all have had a good lunch. Thank you for attending to our health talk. I'm Siti, together with my colleague, Jovin. I'll be presenting on Live Well with an end in mind, palliative care. As Felicia mentioned, the topic can be very sensitive. So I apologize first if you all feel very upset, or along the way I might offend. There's certain presentation that's offending along the way lah. Okay, but this is a learning opportunity for everyone. Okay, thank you. Hold on, just give me a while, yeah. Okay, let's begin. So as nurses and family, we always encourage our patients to live well, but it is also as equally as important to also end well. Also, like any other life stories, life is a journey, and also to have a good journey, we begin from a good start, right? So possibly we want to end with a good end. So how do we do that? In this talk, we will try to help the end process or the end journey of our residents and our families. The content for today includes what it is to live well with an end in mind, and why do we need to talk about it. We're going to discuss the stages of illness in palliative care, the definition of palliative care, the benefits and the types of palliative services for our residents and families, and how do we care for our loved ones, which is very important. Normally at the end of life, we do not know, we are at a loss of how to take care of our loved ones, right? So we will provide you care tips on how to take care of your loved ones, and also on how to take care of yourself while looking after your loved ones, which is also very important, because you need to look after yourself to look after your loved ones. Okay? So let's go through. So firstly, how do you live well with an end in mind? So talking about death, as Felicia mentioned previously, it is a taboo. Why is it a taboo? Because we don't like to talk about death, right? Because normally death is always associated with pain and fear, or hospitalization, or getting poked here and there. So we hope with this talk, it can somehow or rather make it a lesser taboo subject to talk about. Okay, so a lot of our major ethnic groups are less comfortable talking about death, and minority races like Caucasian. So these conversations are not only about death and dying, but more importantly about living well to the end. So each person, that holds different meanings for each person. And we hope that by talking about this, we are able to help you put more at ease during your life journey to the end. So how and why? So firstly, importantly, is to let your family know about your end of life preferences. You know, in the olden days, a lot of times people do not dare to speak up, like, you know, when I grow old, I do not want to have anything. I want to be comfortable. It's very difficult to tell your loved one in the olden days that you do not want to be cared for, or you do not want to be poked here and there. But currently, we have a lot of documentation that we will go through later on to let you all know how to actually ease and reduce the stress and anxiety of families if, let's say, they have to make decisions on your behalf one day. Okay. So before we start to think about the goals of care, the beliefs, can you think what is living well means to you? Okay, to some people, it could be spending time with loved ones. It could be living life to the fullest. Or it could even be as something simple as staying at home and not doing anything, right? Yeah. So different people have different meaning of living well. So as I mentioned, we have a few tools and documentation that help to ease the end process. So these tools can be used to plan a good end of life, to prevent stress. To prevent stress and uncertainty for you and your loved ones. So this includes doing up certain documentations when you still have the mental capacity. So what it means by mental capacity means you are able to make decisions by yourself. Means you're able to say yes, say no, and what you want and what you do not want. So firstly, let's go through, I'm just going to briefly touch on this. So ACP or Advanced Care Planning is a documentation of care preference should you lose your mental capacity. Number 2, the lasting power of attorney. It is a legal document to appoint a trusted proxy or someone that you trust to make the decision maker and reliable and competent to act in your best interest. Thirdly, the Advanced Medical Directive. This is an advanced document, a legal document that you inform the doctor in the event that you become terminally ill or unconscious, you do not want to have any life-sustaining treatment. And fourth, will planning, which will be done according to your wishes when you pass on. And lastly, CPF nomination, which will be paid out to the nominated person in the event of death. Okay. So then you ask, so when will this documentation take effect? Will it take effect if I'm still alive? Okay, so for example, should you lose your mental capacity, meaning you fall sick and you lose your mental capacity, you cannot make decision, you cannot think for yourself. So that's when the ACP or Advanced Care Planning, AMD or Advanced Medical Directive, and the lasting power of attorney will take effect. Okay, and how about death? How about your will and your CPF nomination? So that will take effect when you have already passed on. So whatever that is stated in your will and your CPF nomination will be processed accordingly to previously during when you make them lah. Okay. So there are 3 stages of illness in palliative care. Number 1 is symptom management. So symptom management takes place when we are recovering from illness, but not yet nearing death. So this is to also ensure comfort throughout the recovery process. So number 2, when the disease is approaching the end of life, hospice care ensures the quality of life and comfort rather than treating the illness. Okay? And then lastly, when the death of a loved one occurs, bereavement support helps with the physical, psychosocial, spiritual needs to cope with the grief of losing a loved one. This includes community support groups and also counseling groups. So again, what is palliative care? I keep talking about palliative care, end of life care, palliative care. So what is it? Okay, in palliative care, there are 4 dimensions, which is physical, psychological, social, and spiritual. So it is when one is diagnosed with a threatening life illness, And then palliative care provide long-term care and support with symptoms management to relieve suffering and also improves quality of life for patients and family members. So this is also known as the journey throughout the treatment process. Okay. So throughout the treatment process of a particular patient who has a life-threatening illness, it's a process, it is journey together with you. Okay, but do not panic. How do I get all these services? Do not panic. whenever a patient is diagnosed with palliative services, palliative care, a palliative doctor will come and we will introduce all the palliative services to you. Okay, so do not panic that, oh, doesn't mean if I have this, so how do I do all about this? Okay, do not worry, do not panic. Help is always within reach lah. Okay. So in Singapore, palliative care and hospice care are used together and very, very common. If you have palliative care, you also will have hospice care. Okay. So who can benefit from palliative care? Okay. So palliative care doesn't really gives to elderly, but from the babies as well, if they have threatening illnesses lah, such as advanced cancer, chronic diseases like end-stage kidney, heart, lung, and even brain failure. All these patients can benefit from palliative care. So what are the different types of palliative care services? So in Singapore, there are 3 types of palliative care services. We have palliative home care, palliative day care, and also inpatient palliative care. Okay. So these are the hospice and palliative care service providers. Okay, as you can see, there's a few hospitals and hospice that provide all these services in Singapore. And for palliative consultation, as I mentioned previously, oh, don't panic, because in most hospitals, we have palliative consultations. And from these palliative consultations, you have palliative doctors and also palliative nurses who will provide you with all the necessary information that should be required, okay, at the end of life care. Okay, let's go through what is palliative home care. So palliative home care means, as the name suggested, receive the care and comfort in their own homes. Okay, and this involves a healthcare professional managing symptoms of advanced illnesses. And this enables patients to stay in their familiar surroundings, which is their home, for as long as possible. Okay, one of it is that for palliative home care, there will be a nurse that will be assigned to take care of the patient at home. And depending on the severity of the diseases, the nurse will decide the frequency of the visit to the home. It could be as long as monthly or 2 monthly. It could be as frequent as daily, depending on the severity of the disease. Okay. Next, as the name suggested, daycare. Daycare, like any daycare, palliative daycare. So what do we do? Palliative daycare provides a few hours of respite care for our caregivers as well, and also provide care for our, work. Some of their children have to work, right? So it provides like a supportive care and a safe care for their patients under the safe environment. And then they have activities and also therapeutic programs such as art and music therapy. And lastly, as the name suggested, inpatient palliative care, meaning in the hospices lah. So they require specialist care that cannot be provided at home. In these places, of course, as we have a team of doctors, a team of nurses or healthcare professionals, we have a lot of therapies that manage the symptoms, promote comfort, and of course, improve the quality of life of the patient. Next, I'll pass to Jovin. She'll explain more on how to provide comfort for your loved ones.
Hi, thank you, Siti. So now I'm sharing on how to provide comfort care at home, as it's important to focus on their comfort during their final days. So fear and hesitance due to surrounding death often impose stress to the family members. Family often will ask when a loved one will die. So we hope this information helps to answer some of their doubts surrounding death and help to prevent the family members in dealing with the most important issues that still need to be resolved. So as death draws near, you may see some signs with our natural responses of the body preparing itself for death. And do remember, not all will experience all these signs and symptoms. Okay, let me ask you all one question. Do you think food is important for term ill patients? Who can answer me this question?
Yes.
Yes.
Yes. Why do you think it's yes, Christina?
Yes, of course. It's We need food to survive.
Oh, okay. Any other more answers that say yes, or somebody will say no?
If we eat the nutritious food, then maybe his life will last longer.
Strong.
Okay. Okay, let me share with you, okay? Okay. So the answer is no. Yeah, because a dying person often reduce the intake or stop eating food and drinking fluids. So as the body metabolism slows down, right, not much food or calories are needed for them. So we can help to provide some comfort by giving them sips of water or some drinks that they like, provided they are not drowsy. If they are drowsy, right, please do not serve them water because they will choke. So if they do not drink water and the lip is very dry, you can wet the mouth with cotton ball or apply some lip moisturizer. And lastly, do not force feed, as I mentioned, as they may choke. Okay, second point I'm sharing is about the breathing. So your loved one may breathe with mouth open, like gasping for air, due to the muscles that is relaxed. So breathing may be irregular, shallow, or may stop for a period of 10 to 30 seconds. This usually does not disturb the dying patient. So for better comfort, you can position the patient on their side, as this helps to drain the secretion out of the mouth or raise the head of the bed. So you also can provide some small fan to blow near the patient's cheek to provide more comfort. And if there's a lot of secretions, right, you can ask the doctor to prescribe some medication to decrease the secretions. So do not be alarmed if there's a gurgling throat sound is heard, as is due to the inability to swallow down the saliva. So these sounds can be very upsetting to the family members, but patient normally doesn't have any discomfort. Okay, next, during the dying phase, right, they may become restless, which may be due to their physical discomfort, such as full bladder or rectum, but can also be a sign of emotional distress if there is no physical discomfort. So to reduce the restlessness, we may want to stay calm and provide assurance by holding their hands gently, or you also can play some soothing music for comfort. Most importantly, please do not panic. Okay, so for the eye care, they tend to sleep and rest more, as is mostly due to the chemical changes in the body. So it's very normal for your loved one to become very sleepy and may not respond to you. So it's best to speak to them as normal, as they may be able to hear you but unable to answer you. Do remember that hearing is the last sense to lose. So if they do not have any, cannot sustain any conversation with you, please do not be so disappointed. Okay, so I will talk about eye care. So the patient may sleep with eyes half open because he has lost a lot of weight and eyelid cannot close properly. So to provide better eye comfort, we can assist by changing the position of the head, and this may allow the eyes to close more easily. We can still instill 2 hours eye drop for them. And lastly, we should not force close the eyes. Okay, now is quiz time. Can we a guess? Do you patients feel pain and all? Do you think they have pain?
No.
Some have, some don't have.
Some have, some don't have. Okay. Yeah, correct. So answer is some dying patients never have pain, while in others, the disease may cause severe pain. So the degree to which a dying patient feels pain is related to the disease process, not to the act of dying itself. So there's medication that can be prescribed to reduce the pain to a bearable level for as long as the patient lives. So the medical doctor, the nursing staff may need to review the medication at their home, but it's maybe be more important to keep the patient free from pain than for him to be completely alert and talking. So soreness of the pressure ulcers can often cause some degrees to discomfort and pain. So common pressure sore site will be at the bony areas, example, the sacral, the heel, and the back. Okay, to maintain pain-free, we should change the patient position 2 to 3 hourly as tolerated to promote comfort and prevent formation of pressure ulcers. Because pressure ulcers will be very painful for them and will develop if it's prolonged lying. So we also can place the incontinence sheet and to keep the skin clean and dry. And lastly, we should not omit any painkillers due to the fear of overdosing, and this may cause further distress to the patient. Okay. So for dying patients, they often will feel cool to touch and appear very pale or purple blue in color. Just bear in mind, usually this is not uncomfortable. This is actually a natural process of decreasing blood flow to the limbs and cause the limbs to feel cold. So if the limbs are cold, you can advise them to wear socks or provide them with warm blanket to promote comfort. Try to avoid using electric blanket, and this may be too hot for them. Okay, so as for caregivers, right, do remember to take care of your own health, as the journey from diagnosis to the last hours is very exhausting. So here are some tips to share. First is to have healthy and regular meals. You can use the healthy plate as a guide. Then need to have ample rest, as important to recharge your body. Avoid or limit the use of tobacco and alcohol. We need to exercise regularly to be healthy. And lastly, to allow yourself short breaks and get some fresh air outside. So for communication, you can ask help from others, family members or friends, and also share your worries with them. And you also can work closely with your healthcare providers, your doctor, your nurses, as important so that you can prepare on what to expect next. Lastly, for emotional need, it will be good to maintain a relationship with families and friends. Take turns to take care of your loved ones. Share your fears and concerns with one another. Do have a positive outlook and to seek professional help when feeling overwhelmed, or you can attend to your own spiritual needs through prayers, if applicable. Okay, that's all for my sharing. Thank you for your time. Is there any questions? You can type in the chat box also. We will try our best to answer you.
Yes. May I ask you, how about people without family stay by themselves? What can they do? Is it like if the person knows that surely he or she will die, do you think they will have this thought of committing suicide?
Or committing suicide, if you mean that you are having your last stage of life, is it whether you have committed suicide? Is that what is your question?
If the person still can do it to themselves, do you think they will do that? But my first question is, how about single? How like isolated elderly? How will they? Who can be approached?
So for the first question, right? So the doctor will assess your condition first at home, whether you are safe at home. So if there's no caregiver, and because you need a caregiver to take care of you at home, because sometimes you need injection or this for your symptoms. So they will ask you to go to the inpatient hospital so that there's healthcare providers to take care of you instead of going at home. Because mostly at home, you'll be cared for by your family members or your close friends and those that will be staying with you lah. I hope I answered that question.
So how to prevent people like this if they still like commit suicide? How to prevent?
Sorry, commit suicide meaning
Suicidal thought.
Suicidal thoughts.
That means the resident has suicidal thoughts. Is it thoughts of dying?
Yes. Since they think sooner or later that why want to suffer more. if they still can put in action to commit suicide. So sorry I had to ask this question.
Yeah, it's okay, Miss Christina. That's a very good question. Okay, so firstly, what we can suggest is to bring the suicidal person doctor. Over there, the doctor will actually refer the person to a social worker who can actually speak to them and find out more to the reason as to why they have suicidal thoughts. It could not be the death itself. It could be other underlying reasons. Could be again, as we covered just now, palliative care covers 4 domains, right? So it could not only be the physical side whereby the patient has the symptom itself. It could also be other underlying problems that we might not know lah. First step is to actually get the patient or the resident to go and see a doctor, and then the doctor will refer the person to a social worker who will find out more and introduce the relevant services to the patient. I answer your question.
If you don't mind, ask you one more question. People like this, if they also have financial problem, will the government help?
Yes. So the doctor can refer to the social worker and they may help from there.
Oh, okay. Thank you very much.
Yes, no problem.
Any other questions?
How to get that? I enter late, so I missed the front part. How do I get to the front, the beginning one? The messages that is being, because I got problems linking into the website.
Hello, Madam King. So for this, right? So if you have missed out our first part of the health talk itself, you actually can always go to Radima's Silver Click Facebook page to actually relook at the recording sessions itself.
Is that the scan?
No, this scan is actually for you to actually scan your passion points. So if you would like to earn your passion points, you can actually scan this QR code, which is shared by our Radima's colleague.
Can you explain again how to get to the previous one?
The previous, so we have, do you have a Facebook account?
Facebook?
Yes.
Yeah, I have.
Okay, so you can actually search Radima's Silver Click.
Go to the Facebook, is it?
Yes. Why not? I can share with you the link at the chat box on the Radima's Silver Click Facebook page. So what you need to do is after this session later, you can actually relook at the recording sessions.
Okay, the Facebook, the SGH site website.
No, not SGH. You type Radima's.
Huh?
Okay, let me. I will just start on the chat box. Give me a moment. So on the Facebook page, you search for Radima's Silver. Radima's.
Salima.
Yes.
SALAMA.
No. Let me. I share on the Facebook. I share on the screen. I think David from yes.
Okay. HTTPS Facebook, is it?
Yes, that link itself. You can.
Again.
Yeah, you
switch
can
off
click.
again.
Hello.
Switch off again. I can't see. I don't know why already.
Oh, okay.
Maybe gone on.
Maybe you are using your phone, but it's
I
actually
go to the chat box, is it?
Yeah,
Hello,
the chat box.
is
the session end already?
We are not, and we have not ended the session yet.
Then ask the lady to do it afterwards because she's interrupting our session.
Okay.
No worries, Madam King. We will get back to you after we end this session. You just hold back after this health talk. Okay, then we will assist you on it. Okay, so aside from before that, for those who wants to earn your passion points, you can actually scan the QR code itself. So meanwhile, if you have any other questions for Jovine and Siti, do help to on your mic, and then you can start to share your questions as well. Anyone who have any caregiver experience that you would like to share as well? you can also take this opportunity to share your experience with us. Then we can actually learn from one another as well. Well, you are thinking of the question. We also have our upcoming 28 August. So for this 2 weeks topic, we are talking about palliative care. And then in 28 August and 4th September is in line with the next topic. We are actually talking about ACP, also advanced care planning. So you can actually take a look out for join our upcoming session as well. Oh, we have a question with Serene. May we know what is the ratio of staff to patient in palliative day care, please? I think they can try their best to answer because they do not represent the daycare center itself. Yeah.
From what I remember, through our attachment in RCC daycare hospice, it depends on the center itself and also depends on the activity. Because different activity, they have therapies. So each activity, they cater to a group of patients. So there wouldn't be like, the system, it doesn't seem like other, like a normal daycare whereby maybe two staff to a few patients. But in palliative daycare, because they have a few activities running at the same time to cater to different patients' needs, so they have a different number of staff assigned to each group of activities. Yeah, so different center has different number of staff, different number of activities as well. Yeah. So you need to inquire with the daycare, because every time a patient that gets recruited into the daycare, the staff will explain this activity can cater to how many patients. Yeah, I hope I tried my best to answer your question.
Hello, may I ask another question?
Yes, Ms. Christina.
Regarding hospice, what condition that can apply?
Sorry, hospice, is it?
Hospice.
Okay. So hospice, as I mentioned previously, it is more of towards the end of life. So meaning when the doctor has already said that, oh, okay, there's no chance of recovery. So and then and the patient wants to pass on in the hospice, to have nurses and doctors to take care of them. Okay, so the care is within 3 months, meaning if the doctor tell the patient that, okay, Mr. So and so, you only have 3 months left, or maybe your symptoms is so bad that you cannot be cared at, and then the hospice will take you in. It's really strictly following their inclusion. That means they include their criteria.
Oh, wow! I think caregiver is more burden.
Okay, so hospice also, they have respite care. So that's why this, as I mentioned previously, we have daycare, we have inpatient care. So for daycare as well, this is also to provide the caregivers some respite, meaning a few hours off from taking care of the patients. So for inpatient hospice, the daycare, not all hospices, but some hospices do provide respite care, meaning if they know, like, for example, we have family members going on a holiday, going on a holiday. So they will have, the doctor will need to write a referral to state that they can actually provide respite care to the patient for the 2 weeks that the family is gone. So while the family is gone to overseas, there is somebody taking care of them in the hospital. Yeah, there are such services. Not say, does it mean that if I take care of my caregiver for 6 months and my caregiver has symptoms all the way, does it mean that I have to take care of it all the way? There are circumstances, if let's say the caregiver, because you will have a follow-up with the palliative doctors, right? So there are circumstances whereby the family say that, look, I need time to rest, to look after myself. So as Jovin has mentioned previously, it's also very important for caregivers to take care of themselves, not only to take care of the patients, but also need to take care of themselves. So you need to be healthy to take care of your own family, right? So it is possible to provide respite for the doctors.
Okay.
Can I check? I have one question. So if these patients live beyond the 3 months, so he has to be discharged, is it?
No, so it will be depends on
Hospice is for only 3 months, right? So if this patient happened to live longer than 3 months, so
I
he
think
has
they
to
still
be
can
discharged.
continue to stay in the inpatient hospice until they
Oh,
pass.
so they
What
can
if
still
these
continue.
symptoms will be
Ah,
different? They can-
Right, for the symptom. Yes.
oh, so will not be discharged until the last day.
No, no.
No.
Oh, okay, thank you. Because I witnessed my cousin. Yeah, it was very nice at Dover Road
Dover
Park.
Hospice.
It was
Yeah.
very beautiful. Tang Tok Seng that side. I visited him. So he passed on. It was in June. Beyond 5th of June, he passed on. I visited him. Before 3rd. Actually, yeah, 3rd of June. So very, very good environment, and he was well taken care of. I'm thankful that the government has done a very good job for this. Yeah. Thank you.
Okay, thank you. Thank you, Miss Alina, for the sharing. Yeah, a lot of hospices, actually the environment is supposedly to suit because it's promoting of rather than treating, it's promoting of quality, right? So if you for those who have chance to actually go to hospice, to visit a loved one, the environment is really different from the hospital itself. It is much more calming, and the environment is more of therapeutic per se to provide comfort for our loved ones lah. Okay.
Correct. He was in one room by himself, so it was very good. Yeah, and then the nurse and some attendants were very friendly and very caring. Yeah.
Yes.
Thank you.
Yes, thank you. I think there's another question I believe that whether it's palliative care or hospice admission direct from hospital discharge or the doctor's letter direct by the ill individuals possible. So normally, right, for the inpatient or the home care, there will be a referral from a palliative doctor from the first. Then we'll liaise with they'll put up a referral to the respective hospice that's available to take care of the patient. So it can be from hospice, the ward, or can be from clinic admissions.
Thank you.
Any other questions?
So next week is the Chinese version, this talk. Next week
Yes,
is Chinese
next
version.
week is the Mandarin version of the same topic itself.
Yeah, because today English, next week is it Chinese?
Yes, next week is the Mandarin version, Lawrence.
Okay.
I think we have also another question from Serene in the chat box itself. It's a very long question. Let me take a look first. If elderly patients have the following condition, which is not mobile, need to be fed very carefully and slowly to prevent the risk of micro aspirations, and difficult in hearing, and may have sundown effect, which can sleep a lot but cannot in the day but not at night, and also heart failure. Do you think this elderly patient is suitable for rehab care or home care?
Okay, again, depending on the prognosis of the disease itself. So for definitely not suitable for day rehab care because due to the minimal staff numbering inside and the activities that is catering for all palliative daycare patients. So most palliative care daycare activities mainly for mobile patients. So if you ask whether they are suitable for day rehab care or home palliative care, if the doctor has already informed you that your loved one falls under the day palliative care system, then of course he is suitable more for home palliative care to get the nurse to visit and monitor his symptoms rather than the daycare. It's also for his safety lah. I hope I answered your question, Serene.
Okay, one question. This type of palliative care, is it subject to like the income of the family. Let's say people staying in condo, are they eligible or not? Or must be, these are for low income?
Yeah, so all this is based on mean testing.
Mean testing now.
Yeah, correct.
Oh, so that means like this family can afford, but the patient is I know of a case lah, because they have been told it's the last phase of his life. So a bit concerned that, but they are they are not the low income, they are quite okay. So that means the hospital will not provide such care.
The care will be provided, but if you say whether the care will not be provided just because the person, no, according to means testing, meaning different patients with different means testing will be charged different amount of payment, but of course care will still be rendered and given. But it's only the amount of payment because the palliative daycare, palliative hospices is not only for low income people, it's for everybody. Yeah, it's for everyone.
Okay. So can request or not? Let's say this patient is not Tan Tock Seng Hospital, TTSH patient, but from another hospital. So can request for Dover Park hospice or not?
You mean for the daycare or for the stay?
No, for the stay. The hospice.
You can ask the doctor to put out the referral, then to indicate there for the hospice that you requested. Then it's subject to availability lah for the time being.
Okay. I asked all this so that I can inform this friend of mine, because I visited my cousin, so I find it's very good. It's very the environment conducive, so I would like to share with my friend. So that's why I'm asking for the question in case the need is, there's the need, so I can share with them the call. I mean, of course, information must be correct. That's why I put up here. Thanks.
Yeah. So hospice is for patients in the palliative care journey lah, meaning towards the end, whereby the doctor has already mentioned, we are not going to treat you, so it's more for you to keep you comfortable. So in Tan Tock Seng, he's been seen by a palliative doctor, and the doctor deems that it's either whether he give him choices to go home or to go to the hospice, then you can convey to him about this lah. But of course, at the end of the day, if it's Tan Tock Seng, the acute condition needs to be settled first before going to the hospice. But again, this is all from doctor's referral.
Because she's a patient of NCC.
Okay.
Yeah, cancer patient. Thank you. That's good enough. At least they can find out anyway. But I just can inform them and let them say something. Find out further. Thank you.
Hi. I really feel very I really appreciate you medical people. Wow, not easy, huh?
Thank
you very much.
Thank you. Yeah, so Miss Serene, as I mentioned previously, it's a palliative daycare. Even for palliative daycare, they only cater to mobile patients because they have therapeutic activities that needs the patient to move around, and also due to the limited number of staff in each palliative daycare centers lah. Yeah.
Any more questions?
It's nice that everyone is actually sharing a bit and asking a bit of questions. I was still afraid that not many of you are really will be more afraid to share and actually ask questions about it. And it's good that you all want to know more about what's happening, so that we can actually help a family member or a friend out, which is Florence is one of the example as well, that she actually want to understand more, so that she can actually allow the people that she cares about to have a better care as well. Yeah, thank you so much for sharing. any other questions? We still have a bit of time as well. So you have any more questions in mind? And you would like to check in with our nurses? Actually, feel free to on your mic as well. While you are thinking, Madam King, we will actually SMS you the Facebook link after the health talk itself. We have your mobile number, so we will just drop you an SMS on the link itself, so it's easier for you to look it as well lah. Okay. No more other questions? Okay, then in that case, so actually today as well, I heard Madam Christina was sharing that she's very thankful for all the medical staff. In fact, today is also our Nurses Day. So maybe we will also take this opportunity to thank all our nurses for all their contributions, regardless it's inpatient or outpatients in the community. Thank you them for all their efforts and their patience to take care of all our patients and residents, and maybe also helping out with the caregivers as well. So thank you.
Thank you.
Okay.
Thank
Ayo.
you. Love you.
Thank you.
Thank you. Thank you.
Happy
Yeah.
Nurses Day.
Thank you so much.
Okay.
Thanks to all. Thanks, Radima CC.
Yes, thank you. Thank you.
Yes, thank you of our
Thank you,
partners as well.
Felicia. Yeah.
Yeah. Okay. We have a very out of topic question.
Joving
Also-
and Siti. Thank you.
Thank you. Thank you.
Bye.
Thank you. Bye. 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 Thank you. Thank you.
Bye-bye. Thank you. For
Bye-bye.
Lou itself, you can maybe we can stop the recording first, then maybe we can get our nurse to do a quick sharing about